It's been very empowering for me and for so many others. It is very heartening, and I expect great things from you. So, I look forward to it, and I really want to thank you for being just a wonderful group. It's been a joy being with you. Thank you. Thank you. Thank you. Thank you. Thank you.
In true partnership fashion, I want to give Riane a gift that she can carry back to San Francisco, and that's not a material gift. It's a gift of, I want to hear the ideas that bubbled forth from your table. What are you going to do? How can you become a partner? How can you shift this culture so that real health is possible for all people? So let's hear some ideas. Let's send Riane back happy.
There's a lady here.
Lovely.
I'll just talk loud. I have a college-age son. He's very interested in sustaining the planet. I'm sending him your book tonight.
Good.
Yeah.
I love that. You know, I have to say something. I recently spoke at the United Nations General Assembly, and I made the point that you can't just tack on environmental balance to a fundamentally imbalanced system, right? So he's going to like it. Thank you.
Dr. McMahon and I, did I say your last correctly? Both discussed how we can work with students, I with nursing students, and he with his physician students, medical students, I guess that's what we should call them, to bring this model of partnership to them, to discuss partnership with patients, to discuss other perspectives, to discuss the perspectives of other team members, but also going into someone's room and how that person is also an adult. So I discuss that a lot with my patients, my students, about how they can talk with their patients, be respectful, and we talk about how patients feel, especially for beginning nursing students, to start getting those ideas in your head. So you're thinking about why you would want to be a partner with your patient, because you know that they're also humans. Just because they're in the patient role doesn't diminish that they're people too. And it sounds like you've been taking this to your medical students as well and trying to find ways to use this in kind of family practice for people going into family practice.
That's wonderful. Teddy wants to say something.
I just wanted to add to that. We often will use the correct language and we'll say to our patients, we want you to be our partners. Okay, we say often to say to our patients, we want you to be our partners, and this is what I want you to do. Okay, do you begin to hear the language? That is not a partnership. That's a dominator relationship in partnership clothing. So we have to really get back to trusting that people are adults or children or vulnerable individuals, but they can be invited to be in a relationship with us that forwards their health decisions in the best direction.
And I'm just delighted to hear that you're both planning to use this. And I want to tell you, in addition to the books, on both those websites I've given you, partnershipway.org and caringeconomy.org, there are tons of resources. So have a good time.
It's on. I've been particularly discouraged in my career about what nursing has or has not accomplished around diversity within the profession. And I finally figured out I'm old enough to stop complaining about it and just do something about it. And so in speaking to Dan, my sense was that the organization I should coax to be behind this is Sigma Theta Tau International. They would want what I want for nursing. And when you look at the regions across the United States, it is in the Midwest, in Region 4, where we probably have the greatest difficulty with this because the demographics are moving more slowly here than they have on the coasts or in the South. And then Dan introduced me to Cyrus, who is an entrepreneur and has similar issues and interests. And I think that probably by the end of the year, we'll be able to move the needle a little further on nurses being willing to talk about their differences and similarities and support each other across the cultural bridges that need to be built for us as a profession, and so we can extend that to our patients and families.
I really want to say something which is within the nursing profession. It's not only child care workers that are so poorly paid and so devalued, but it's also nurses' aides. And I really hope that you can all do something with that. Because first of all, it is really the nurse's aide that has that close contact. I mean, they need to be trained and they need to be valued and they need to be rewarded. And I think that would be a very interesting way, to approach that. Just a thought. Yes, there's somebody there.
Should I start?
Oh, yes, please.
I'm Mary Johnson, and I've been a nurse educator for many, many years. And one of the avenues that I have sort of discovered as I am teaching in the Center for Spirituality and Healing now is this new kind of thoughtful framework around spiritual intelligence. And I know about your interest in neuroscience, and it seems like this is an avenue where spiritual intelligence is being looked at as a capacity and an attitude and something that we as human beings all have, but perhaps have not developed. Spiritual intelligence and your partnership theory fit together very well. And I'm wondering if you have gotten into this line of research or reading or anything, Riane.
Well, yes, I have. And I would say that for me, what I think of as partnership spirituality is putting love into action. That it's very important, of course, to center ourselves, to meditate. But then if you really look at some of the cultures, like in Tibet, I mean, I hate to say this because I love the Dalai Lama, but on the other hand, I don't love the structure of that society, where basically the priesthood, who meditated all the time and is supposed to have all of that empathy, really presided over a culture where women are just brutalized, where children are brutalized, where poverty is endemic. So it's not enough for me to do that. I want us to think of meditating, but not just meditating on our own inner peace, which is lovely, which is good, which is important, but then let's take it further and let's really meditate on how can we put love into action. That's what the work you're doing, isn't it? It's putting love into action. So I have my views on spirituality that, again, are not quite the conventional ones, but use some of the conventional wisdom, but try to take it further.
I'm Marty Lewis Hunstiger. I'm a staff nurse and preceptor in the NICU at Children's in Minneapolis, but also I'm the editor of Creative Nursing, the journal that is sponsored by Creative Healthcare Management. And this whole year, we've had an overarching theme of partnerships. And our first issue was called A Paradigm Shifts. Our guest editor was Joanne Kerner, and it was about advances in physics and our whole way of looking at relationships. The second one was called Educating for Partnering, and Teddy Potter was our guest editor. And in our third issue, we had an extended interview with Dr. Eisler that contains some of the material you heard her present today. And then the fourth issue, which will be coming out in November, is Sharing Governance with a guest editor of Tim Porter O'Grady, the guru of shared governance. And I just would like to encourage you to consider checking us out as far as material about partnerships in a whole, range of settings.
Thank you.
Hi, my name is Anne. I'm a nurse leader at United Hospital. You brought up the responsibility of more the future, the bigger picture, and you also brought up NAs. And as you've been speaking all day today, I'm struggling with an employee in NA, very young, has 5 kids from the ages of 2 to 8, single mother, mom moved far, far away. She has absolutely no support, and children that have health issues, so she's the only person that can do anything with, for her children. So she has attendance issues, which then lead to discipline issues, so on and so forth. I most recently met with her, and she says, "I think I have a solution. Her younger sibling, who is 16, got kicked out of the house as well, so he moved up and lives with her now. So he quit school to take care of her kids when they're sick, so she can come to work." And that was her solution, which I struggle with horribly, because the way we're really to handle it is that we have to kind of manage them out. And at the same time, her performance is slipping because she's tired and trying and struggling. But I struggle with what is my part, and you talk about the bigger picture and the future. So the future is that 16-year-old who's now not in school, those 5 children who are also struggling, and whose problem is it? I could say it's not my problem, and that I can manage that person out, but she'll go to another place, and then there'll be an issue there. Those children in the future, what is their future? So it is a struggle, but I guess, as she was saying, a gift to you as you go back, but you started this whole thing with thinking outside of the box. So I guess that is my responsibility, of thinking outside of the box and seeing what else is out there.
Well, there's so many issues implied here. One of them is family planning. No, I mean seriously, because we're in this political climate, we're being told astonishingly that contraception is bad, when actually contraception has, not only for women, but for the society at large, been one of the major factors in a higher standard of living, in a better life. So, of course, I mean, it's not going to help this woman. Well, maybe it will, because she may have other children. Oh, God. So, I mean, I would really say that, obviously, the solution is not her 16-year-old. I mean, that's a terrible solution, because it deprives that child of opportunity. On the other hand, maybe it's a temporary solution that can then be worked out with her to see whether there are some social services that she can avail herself to. And I would really, I mean, first thing, as I said, that came to my mind was family planning, obviously, because she shouldn't be having 5 children that she doesn't know how to take care of. I mean, that she can't take care of, but it's already done. So now we've got to work with that. But if perhaps she can see this as only a very temporary solution, and that she really, perhaps with your help, can find some social agencies, because there are some, that, I mean, some charity, something, some government agency that can give her the wherewithal so that there is childcare for these children. So what do you think? I mean, is that a possibility to sort of guide her into seeing it not as a permanent solution because it's not fair to the child?
Right, and I have directed her towards EAP, and I do find myself spending more time with her. I feel almost obligated to, because she doesn't have anybody else in her life that's providing that, even something as simple. When I talk to her on the phone, she's, she'll turn around and swear at her children or something like that, or not swear, but say, say shut up or something. I'm on the phone, and I've had almost like I'm her mother, and have conversations and say, you shouldn't speak that way. Here's a better way that you could say it. And she's very receptive when I do give her and offer that, but I think that her parents weren't. So
I think the parenting guide, which is very short, it's about 30 pages from 0 to 4, but it also will have information for her for afterwards. I mean, because this is a woman who doesn't have much time, obviously. But that may be useful, and Teddy has some thoughts.
I was just going to say, these people who experience this, people who experience this are not the cause of the problem. People who experience this are not the cause of the problem, they're the symptom of the problem. And so it does ask us and beg all of us to pull back again and say, why is somebody in this situation pushed to the point where she wouldn't make these decisions if she didn't have to? So it's looking at how can we support all people in our society to have the tools they need to make good choices. And if we're the employers of people who are forced to make bad choices, how can we perhaps set up systems like a child-based care at the hospital that will not force her to make these decisions of having a child stay home from school to care for a child? So.
And that, of course, is a very obvious solution. You're not going to be able to implement yourself by yourself, but you would perhaps have a good opportunity to put that in motion. And that would be a much better solution.
Yeah.
So thank you.
Lisa has maybe the last.
One last question over here.
I'm Lisa Benke from United Health Group. And as we've talked about today, there are myriad examples of the dominant system paradigm in healthcare between professions, within professions, and between professions, patients, families, communities. But what you've really done for us today is broaden our horizon and help us to see that this is not a healthcare problem. This is a worldwide economic problem. And as we discussed at our table, it doesn't have to be rocket science. Translating love into action, as you said, is as simple as being who we are and modeling partnership behavior and making that part of how we interact with each other. And we've heard a lot of examples of that today. And what I'm reminded of is something we talked about yesterday about the novice to expert. And somebody said, I apologize for not remembering who it is, but at least be a good novice. And can't we at least be good novices in modeling a partnership paradigm as the world undergoes this very necessary transformation?
And that's the best gift of all. Thank you.
Thank you.
Or do you have some more comments that you want to make?
No,
Please stay here.
I thank you all, as I did once before.
And I think you'll be talking even when we are finished here, because so many people want to talk with you. Yes, and Fabiana's going to help me now, and what I'm going to be trying to do is to somehow not pull it all together, but I do want to hit a key couple of points. And one is the original motto on your tables of the summit was from the first summit, and those 6 loops are the original 6 sages. But if you'll notice your name tags, there are just a whole number of little loops here, which now symbolize the expansion of the sages. So the original 6 have now become 600, perhaps, that are going to go forth and do great things. And I want to bring us back way personal now. The ultimate both and, just a second, the ultimate both and of making major societal change and then influencing those who are close to us. And so I want to start with what we learned yesterday, maybe the best damn coupler in the whole white world, and that's this woman right here. Yeah. Please stand up. Thank you. And all the things we said yesterday about the coupler, you probably didn't hear half of those because you were running around making this work. Yes, yes. So you look, but you are the best damn coupler in the whole Minneapolis and the whole white world. So thank you from all of us. Thank you so much. I also want to thank the Planning Committee again, and all of you, because as we said, the Planning Committee, if you could please wave your hands or stand up again, because you have done a phenomenal job. And yet all of you really made this happen. And so the number of sages and participants, next time, maybe 500 represented there. I want to bring some closure, and it won't take many minutes. I want to talk again about the ultimate both and, which I think we were charged with today. We've gone from organizational to small group to society to the world, back to the individual. And so the ultimate both and is we're going to have to be doing a number of things. Nobody can do everything. As Jane told us, start where you are, use what you have, do what you can. And I would add, connect with who you think can help you move forward. And so, I do need actually the thing. I want to end with a poem that is actually started from a coupon book that I got. And I love this phrase, and it backed me into the poem, which I personally think is perfect for today. And this is going to be our last reflection exercise. It's not going to be a small group discussion. It's going to be back into self, and then you probably will burble into discussion, as we have seen. But for me, the most important line is the last. But how this relates, I want to just read this poem from Mary Oliver. Who made the world? Who made the swan and the black bear? Who made the grasshopper? The grasshopper, I mean. The one who has flung herself out of the grass, the one who is eating sugar out of my hand, who is moving her jaws back and forth and instead of up and down. Who is gazing around with her enormous and complicated eyes? We might say, what is she seeing? Now she lifts her pale forearms and thoroughly washes her face. Now she snaps her wings open and floats away. I don't know exactly what a prayer is. I do know how to pay attention, how to fall down into the grass, how to kneel on the grass, how to be idle and blessed, how to stroll through the fields, which is what I have been doing all day. Tell me, what else should I have done? Doesn't everything die at last and too soon? Tell me, what is it you plan to do with your one wild and precious life? What is it you plan to do as a result of being here with such fabulous colleagues with your one wild and precious life? So on your table, there are some cards. They're blank cards that Fabiana has skillfully prepared for us. And actually another colleague, I do want to just mention Anisha Tucker, who we have worked with in the School of Nursing, who isn't with us here today, also instrumental, as so many of our colleagues at the school are. But Anisha helped develop these cards. And what I'd like you to do, what often is done is you write something, you hand it in, we mail it to you. No, we're a state school, so we're going to have you take it with you. We won't be mailing it to you. But there are some questions I'd like you to reflect on. This ties us back to yesterday and some of the comments today. It is the people with whom we move forward that really are going to enable us to do some of the big things and then some of the very small things. So what I'd like you to answer and reflect on yourself and take the card. Don't leave when you're done because we've got one final comment to make. But I'd like you to reflect on these questions. We heard about biogenic relationships. So who is someone who has mentored you, created professional joy, and to whom you are going to send a thank you note, maybe out of the blue, but say to that person, you made such a difference to me. Pay it back. Then I'd like you to think of a specific person. Who is a colleague that you slog through the trenches with, that you want to thank, somebody in your concurrent environment, or a colleague, or a teacher, that you want to thank for nourishing your professional joy. And I want you to write that person's name down. Again, the recipient of you've made such a difference in my life. Maybe you don't know it. And I think those of you here today that have said that to me. The third is, how are we going to pay it forward? How are we going to bring the next generation in? Or maybe not even somebody that young, but somebody new in their profession. So who is someone younger? What is that person's name that you intentionally commit to reach out a hand and help them as they develop in into their professional path? And it doesn't have to be nurse to nurse or dentist to dentist. So take a minute to write the names of these 3 people down. And I will see that as a commitment and ask you to take this card back with you as far as a way to spread professional joy beyond those who are in this room. I think most of you are done, or if not, I would ask you to continue that thought and carry out that thought. So we are bringing to a close this fourth Summit of Sages, and I am very pleased to welcome my colleague, Dr. Dan Peshet, who will bring a formal closure to this summit and let us know what can we anticipate in the future.
Okay, don't go away. So I put Joanne Dish at the top of my list in terms of something actionable that I could do. And one of the things that I want to do is I want to bequeath to her a book that someone bequeathed to me after my presidential term as president of the Honor Society of Sigma Theta Tau International, and it's called The Joy Diet. It's called 10 Daily Practices for a Happier Life. And I shared some of those practices with people at our preliminary reception. But after she reads this, I want you all to call her up and have a conversation with her about how she's doing. Thank you so much, Joanne.
Oh,
Thank you. So the future, wow. This has been an amazing summit. Several people have come up to me and asked me, what is the Densford Center? And so I thought I would share a little bit about the purpose of the Densford Center. And it's to promote the development of nursing leadership capacity through programmatic efforts that enhance nurses' knowledge, skills, and abilities to navigate the complexity and lead successfully in contemporary healthcare contexts. And so programs and projects of the center are designed to develop the generative and the transformative leadership skill set of nurses locally, regionally, nationally, and across the globe. And I've been here about 3 months now, and I have spent a great deal of time reading about the life, the history, the contributions of Catherine Densford, who was the dean of the School of Nursing here from 1930 to 1959, so a very long span of influence. And so here is what I have gathered from reading her biography in terms of the things that she valued and believed. It would be interesting to have her do the value sort. But she believed in character, competence, and healthy communities. She believed those who aspire to a nursing career are dedicated to a purpose and are imaginative, daring, and have initiative. She also believed nurses should make the most of their abilities and talents. Nurses ought to have a high sense of responsibility, foresight, and a cooperative spirit. Nurses ought to have deep understanding and sympathy, the ability to think and come to conclusions. Nurses ought to establish close personal relationships, realize the importance of leading as well as the value of following. And nurses should respect and use democratic principles to support group work dedicated to a greater community and social good. Nurses ought to keep an eye on the future, be intellectually curious, possess an eager mind, be dedicated to and work consciously toward fuller international understanding of nursing contributions to the health of local and global communities. And to that end, I believe that Catherine Densford was a very wise woman. And so going forward in terms of the Densford Center, we are going to concentrate on tapping the wisdom of nurses and helping nurses develop wisdom. Because together we can be wiser than any of us can be alone, and we need how to know how to tap that wisdom. And the wisdom is the capacity to appreciate the wholeness of life with an expanded, deepened perspective, and to act on that appreciation to serve the long-term common good and to learn life-serving lessons. So a couple of initiatives that are coming forward. I've been in conversation with Mary Jo Kreitzer and the Center for Spirituality and Healing, and we are going to create a series called the Wisdom Dialogues, public conversations with nursing thought leaders. And we'll probably have 3 of those over the next year and 4 next year. And one of our first leaders is going to be Eleanor Sullivan, who has written a book about how to be influential. And we are putting together an advisory committee to talk with people about other thought leaders that they think will be useful for people to hear. And then we do have, I want to introduce another person who's been a guest with us, Dr. Elle Allison. Could you stand, Elle? Elle is the founder of a company called Wisdom Out, and we are in negotiations with her to partner with us on the development of a program we're calling the Wisdom Project, where she will work with agencies and groups of 10 to 12 nurses in an agency over a 3-year period to anchor peer-to-peer coaching and leadership at the point of care around a particular project that the individuals will identify as important to them. And so we're really looking forward to that. And then the third major initiative, we're currently involved in discussions with the Gallup Corporation. I would like every nurse in America to know their top 5 signature strengths. And I would like the Densford Center to be the portal in collaboration with the Gallup Corporation to do that. And as many of you know, the Gallup Corporation has worked very closely with the University of Minnesota, and we have a strengths-based initiative here. And every freshman coming to the university now knows their top 5 strengths, and they use that knowledge as they move through the curriculum in terms of making decisions about career and about relationships and about choices and how to influence and work with groups. So those are some things that we've got on the docket and the drawing board. I also think the Densford Center is going to link to the Caring Economy website and perhaps provide that as a resource for people in terms of other kinds of things that will make your life more full of wisdom resources. And so those are some things that we look forward to. And to that end, on November 8th, we're going to have a leadership resilience workshop, which will be on November 8th at the McNamara Alumni Center here. And it will provide people an opportunity to build on this nature of joy. And there is a resilience assessment that you'll do that Elle has developed. And she's going to work very closely with 50 people to kind of figure out how you maintain your leadership resilience and how you can take adversity and really develop resilience, not only for yourself, but for your people in the organizations with whom you work. And so we hope all of these things will continue the great legacy that Joanne has left in regards to the Summit of Sages and the ongoing work in terms of helping nurses expand their leadership capacity. So thank you very much for your support and your participation and all your engagement, and I wish you a very blessed, safe travel weekend.